wind changes direction, we may lose the town. If the wind changes direction, we may lose the town. We live lessons and we tell stories. First story. The wind changes directions, we may lose the town. I'd been working at my clinic. My nurses dragged me out of the exam room, put a phone in my hand, and I heard the father of my son say, if the wind changes direction, we may lose the town. Our son was maybe 5 months old, and with him was also my elderly mother who has breathing issues. My colleagues took my patients for the rest of the day, and that afternoon, without hesitation, I rushed out of the clinic and drove 60 miles towards Red Lodge, our home, towards the mountains and towards a growing fire. It's terrifying to drive towards a fire, but I knew my son's fathers would take care of the gathering of the stuff, the pictures, the important papers. My assignment, get the baby and the grandmother, get the billings, and head to the hospital to be on call that night. Laurel, Rockvale, Joliet, Boyd, Roberts, Fox, finally Red Lodge. You can see and feel the smoke. Right at the beginning of town, the first thing you see is the fire station. All of the engines are gone. And there are so many cars parked all around there. Cars I recognize from my friends, from my neighbors, trained volunteers, firefighters. They've gone to the fire, to the lines to protect our homes. I drove on, picked up Mom and Amos, and I headed back to Billings and to be prepared to be on call if necessary. I'm a doctor, I'm not a firefighter, but my friends and patients were out there on that line, fighting that fire. They stood between our homes and desolation. I trusted them to do their jobs, and they knew that if they got hurt or injured, or anyone in their family got hurt or injured, my team would do our best to take care of them. To this day, I am so grateful to have lived in such an amazing town and know people in so many different roles. Me, I was a doctor, and to some a friend, a neighbor to many, and in one way or another, we all took care of each other. Today's talks are on democracy. This is the essence of a strong democracy. Working together, valuing every contribution, and understanding that we are stronger when, although we are playing different roles, we stand against adversity as one. Democracy is both an ideal and a tool. The method we choose on how we exert power. And democracy is worth saving and strengthening. And the first step is courage. The courage to save democracy, because in a strong democracy, we are free to be our individual selves, yet we can succeed and achieve together. I'm Dr. Renee Crichlow. I am a mother. I am a wife. I am a sister. I'm a family doctor. I'm a teacher of medicine. I'm the daughter of immigrants. My life has been a series of lessons. And today, being back in Montana reminds me of how much I learned here while surrounded by the mountains and the people I love. I want to share some of those lessons with you through stories that highlight the power of community and the deep connection between our actions and the health of our democracy. Another day, another story. It was park building day in Red Lodge, Montana, and I was thrilled to have the weekend off to join in. It's an amazing initiative. On my days off, you might find me in my Uggs and my cargo shorts and my fleece vest. I looked a little more like a 14-year-old boy than a physician. As I approached the volunteer tent, the organizer comes up, she goes, "Skilled or unskilled?" And I'm like, well, in my head, I'm like, well, I'm a full spectrum family doctor. I do inpatient, I do outpatient, I do ICU, I do obstetrics. And, technically I'm a highly skilled professional. And so I inquired, I said, okay, so what is your definition, what is your criteria for skilled? And she's like, can you pull a straight line with a router? And I was like, what's a router? Bam, unskilled. And I am assigned to lead a herd of 14-year-old boys with wheelbarrows moving mulch to various areas around the park. It was hard work, but more than that, it was actually fun. Seeing so many people gathered from our town in the park, building the place where our families would play together. It was heartwarming. I witnessed amazing craftsmanship. People with their own tools and their own hands building beautiful things. And there's one guy, I remember he was on a bobcat with one of those front-end loaders, and he backed through a wooden gate with like half an inch to spare. I was like, that's skill. That is skill. I smiled, went back to my wheelbarrow, I moved some more mulch. It was a democracy of effort, where every contribution, no matter how small, was essential and respected. That day we reinforced the foundation of our democracy by valuing each other's roles and by building a sense of community. Days like that were very special. We felt a part of something. But there was also a sadness and a suffering in the hearts of some, and it could not be seen. Fast forward 2023, and Montana faces a really grim reality. The state has the second highest gun suicide rate in the country. And the county that I love the most is one of the highest. Too often, we discover too late that our healthcare system is fragmented and our economic safety net is non-existent. Too many people are falling through the cracks. Rural America is at risk when accessing healthcare means delaying care. Our entire country is facing a crisis where people are dying sooner and living sicker than most other developed nations. And this situation is even more dire in rural communities and urban marginalized communities. Equitable access to healthcare in rural communities has always been a challenge. It was a challenge I faced when I lived in Red Lodge, and it remains an issue today. 16 years ago, I woke up one morning, 37 weeks pregnant. Well, it didn't come out of nowhere. But I was 37 weeks pregnant, and I woke up and started having contractions. And as I drove to work that day, I pondered as I drove 2 blocks from my house past the hospital that had stopped doing deliveries 3 years before. I would drive 60-mile journey in 60 minutes. I'd reach Billings, my daily commute, but somehow it was a little different. Thankfully, I was not in active labor yet. I made it easily. And after 20 hours and an emergency C-section, our son Amos was born. But not everyone's that fortunate. How many stories are there of babies delivered on the way to the city, or of delayed care that turns into inequitable and dangerous or denied care? These experiences fueled my passion for advocating for health equity for all, because I've witnessed how the lack of care can destroy and how putting resources where they're needed the most can transform. Let's take a step back in time. 1930s, less than 11% of rural America had electricity. This lack of access to a fundamental resource impacted the lives of millions. But then something remarkable happened. The Rural Electrification Administration was established as a New Deal agency to bring electricity to rural areas. By supporting locals developing electrical co-ops and individuals' families getting their homes, their farms, their ranches wired for electricity. Red Lodge still gets its electricity from one of the co-ops that were built and facilitated through the REA and its support. Due to our country investing in rural America through the REA, by the 1960s, over 90% of rural America had electricity. This transformation brought with it light, economic development, educational development, improved healthcare, greater industry, improved quality of life. The REA is a shining example of what we can achieve when we prioritize equity and invest in our communities. Even in the early stages of investment, every dollar spent through the REA put $4 back into the American economy, showing us that a strong democracy can mean ensuring that everyone, regardless of their location, has the resources they need to thrive. We all do better when we put resources where they're needed the most. The REA changed the capacity for all Americans to succeed. Now, what could be another leap forward? How about facilitating the development of a rural and underserved urban communities with high-speed broadband internet infrastructure and connectivity? It could be similar to how the REA evolved. This can catalyze rural economies, decrease isolation, elevate education and remote work, support new and old industries. Things like a more robust telemedicine support for rural hospitals, and even innovation and funding to enable them to bring back services like delivering babies. And what would be the impact for the nation? What would be the impact for the nation of accelerating rural and underserved urban high-speed broadband internet connectivity? It would be creating better systems. And when we do things like create the better systems, we achieve together and we become better outcomes for all of us. So again, what does it mean to live in a democracy? Is it a form of government or a way of life? And I'll tell you, a strong one is the latter. And let's be very clear. Violence must have no place in our political process. Violence must have no place in American democracy. Those days have to end. We can and must do better. Violence is a coward's path. We are strongest when we stand for each other and when we remember this is the land of the free and the home of the brave. We can burn based on fear, or we can build based on hope. We've seen hope. We've known fear. And now more than ever, we need courage, the courage to build and support our communities. And equity can point the way. And our democracy needs all of us. So as life is about lessons, and we learn from the stories we tell, I'll leave you with one last story. The words of another poet. He drew a circle to keep me out. Heretic, rebel, a thing to flout. But love and I had wit to win. We drew a circle and took him in. Our developing democracy needs us to have courage to create that new circle. One that grows in strength and is guided by equity, by embracing differences with kindness and care. Our country grows from a surviving bunch of individuals to a thriving set of communities. Know this, we are best when we are a people of courage. And courage is what we truly need right now. Courage to care, courage to be kind, courage to turn from the worst in ourselves and strive to see the best in each other. Because as Martin Luther King expressed, darkness cannot drive out darkness. Only light can do that. Hate cannot drive out hate. Only love can do that. If the wind changes directions, we may lose the town. No. My neighbors and friends stood on that line to protect our homes, and they did. I continue to stand in line to protect their health, and I will. And together, we will build a stronger democracy with liberty and justice for all. Thank you.